We're contracted by CMS to cover various states. IPRO covers New York, New Jersey, and Ohio. Health-centric advisors covers Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. And Clarent covers Maryland, Delaware, and the District of Columbia. So we are three companies together under the IPRO QIN-QIO. So if you know health-centric advisors, Clarent or IPRO, you know IPRO in general. So glad to have you with us. Want to make sure that you know our name and know who we are. We'll get started. Next slide, please, Melanie. So while we are moving on from talking about boosters, I do want to continue to just start us off each week where we're currently at as far as the booster rates within the residents and as staff within the facility. So I have the most recent publicly available data on the CDC shown here. But I actually took some time, not shown on the slide, to actually pull out the states that we cover and the booster rate for the residents. So I'm going to call them out one by one. You can just pay attention to, hear what state you're from, just to see how your state is going. Maine resident booster rate is around 90.6%. New Hampshire is 88.6. Vermont is 89.1. Massachusetts is 91.4, Rhode Island 86.4, Connecticut 89.4, New York 83.1, New Jersey 83.2, Delaware 91.4, Maryland 83.9, DC 76.8, and Ohio 73.6. So those are the booster rates for the residents. Overall, we're doing really great, certainly better than some other areas in the country. So we want to just continue to push that booster messaging within the facilities and everyone that we know, especially since, we're starting to roll out those second doses and stuff. Next slide, please. So this is the percentage of staff in the nursing homes with for the staff rate of receiving their booster. It's a bit lower compared to the residents across the country, but I did pull some state-specific metrics for the boosters as well for the staff. So Maine has 63.2% of the nursing home staff boosted, New Hampshire 63.3%, Vermont 68.4%, Massachusetts 96.3%. Great job, Massachusetts. Yeah. Rhode Island 62.1%, Connecticut 92.1%. Good job, Connecticut. New York 66.2%, New Jersey 80%. Great. Delaware 53.7%, Maryland 54.5%, Washington, D.C. 86.6%, awesome, and Ohio 40.6%. So there's definitely some, areas of opportunity to continue to boost our own staff within the facilities. I know it can be challenging, but we want to continue to get those numbers up there. Next slide. So yeah, just a recap of those who are joining. We had went through our Booster Blitz series. It was more than a clinical series of tasks. We talked about, the pandemic, variants, disruptions, staffing being ravaged, etc. But now we're just talking about bouncing back, coming out of this pandemic, knock on wood, even though COVID rates are coming up. And, talking about how are we, coming back from literally crawling out of hell. We're talking about using the IHI framework of improving joy in work. And we've gone through several sessions already. We're on session 7 now. Next slide. Last week, we talked about measuring joy and how you're measuring joy. We used various different measures that you can use to start to measure joy within your own facility, sort of create that baseline and see what's going from there. I wanted to just pose a question quick. Either you can take yourself off mute or put in chat. Did you take any of the examples from last week of measuring joy and implement that within your own facility? I know there's those those 3 questions that we had added as well. Did you either use like the marble jar that we used for an example, or did you ask a few questions? Put it in chat, take yourself off mute and let us know. Next slide, please. So this week we're going to be talking about cultivating wellness and resilience. We know that health and resilience and self-care and stress management and all of that is really important to the well-being and health of the whole person. So we're going to talk about cultivating wellness and resilience, and we'll get started now. Next slide. So cultivating wellness and resilience. How can we go about cultivating these? Next slide. We actually need to understand what wellness is. So wellness is a dynamic state of physical, mental, and social well-being. Some researchers and clinicians have actually viewed wellness as the result of 4 key factors over which an individual has some control: the biology, their body condition and fitness, the environment, their lifestyle, and healthcare management. So the wellness concept is the notion that an individual's the individual healthcare and healthcare programs should actively involve the promotion of good mental and physical health, rather than being concerned merely with the prevention and treatment of illness and disease. Next slide. So yeah, like I said, it really just goes beyond physical health, but physical health is a component. We need to make sure that each one of us are getting, our normal exercise, having a good diet, maintaining ourselves, conducting stress reduction activities, limiting the amount of stress that we have, and relaxation. But wellness actually incorporates a lot of other aspects as well. Intellectual wellness, expanding our knowledge and education, reading, writing, exploring, listening, observing, and questioning everything. Wellness can impact our career as well, finding satisfaction and worth in our work, professional development, joy in work. That's why we're here. Emotional, having positive feeling towards yourself and others, the social interaction with others, your relationships, having fun, and the spiritual aspect behind it too, seeking meaning and purpose, your self-reflection, religion, community service. All these components together go into that whole aspect of wellness. Next slide, please. So if you've been on a few slides already, you'll know that it's all about love. That's my motto, and that's the motto that I ran my facility in years ago. Ultimately, every single one of us, what people need the most is to feel love. I put some quotes here. Leadership is not about love. It is love. It's loving your mission. It's loving your customers, and it's loving your people. And this is from Ken Blanchard in the 1 Minute Manager. And if you're a fan of The Office, this was a quote that has really stuck to me as well. Business is about people, and people will never go out of business. So we're all guilty of exalting data that we can quantify, like profits, return on investments. But when we're managing these indicators of business performance, we often really forget from whom that comes from. So it comes from our employees, it comes from our workers, it comes from each and every one of us. And when I'm talking about love, I'm talking about unconditional love. If you're working and everyone gets that conditional love from their manager when we do something right, great job, you did this. And that can give us, brief moments of satisfaction. But really, at the end of the day, a lot of us are often felt still left with a void, yearning for more. And unconditional love is what can actually bring joy in people. And it's all about love. That's like I said, that's the model that I ran my building on, and it really made an impact. And really, you could see it in every single employee. Next slide, please. So, love. What are you talking about? Let's put some science back into this. So, there was actually a 2014 study called "What's Love Got to Do with It?" And it was the influence of a culture of companionate love within the long-term care setting. So in this study, they were building upon a theory of a culture of companionate love, which is, feelings of compassion and caring and tenderness for others in the workplace, and examining the culture's influence on the outcomes for employees and the patients that they serve within the long-term care setting. So they use measures derived from outside observers, employees, family members, cultural artifacts, and found that an emotional culture of companionate love at work positively relates to employees' satisfaction in teamwork and negatively relates to the absenteeism and emotional exhaustion. So employees' traits or had positive affectivity, one's tendency to have a pleasant emotional engagement in one's environment. Specifically, they also found a positive association between a culture of companionate love and patient outcomes, specifically having having better moods in the patient, their overall quality of life, patient satisfaction, and then fewer trips to the emergency room. So the study was actually pretty amazing to go through. There's a link that I can put into the chat for you guys if you're interested in taking a look at it yourselves. I don't think that link worked. Let me try this one. And that didn't work either. I will send it out to Melanie so that we get it to you guys after this call. I apologize. But yeah, I think it was amazing to go through. Take a look at it yourselves. You might be, and I know it sounds silly, but really, take a look at how you can integrate unconditional love and companionate love within your facility. And I'm telling you, it's going to make all the difference in the world. So companionate love, Margie actually reached out to me. Next slide, please. Margie actually reached out to me afterwards. She's like, companionate love, what is that? I thought you misspelled compassionate love or something. So, what does an actual culture of companionate love look like? So, imagine a pair of coworkers collaborating side by side each day and expressing caring and positive affection towards each other, safeguarding each other's feelings, showing tenderness and compassion when things don't go well. And now imagine a workplace that encourages those behaviors from everyone, where managers are actively looking for ways to create and reinforce those close workplace relationships amongst employees. Most importantly, though, it's really those small moments between coworkers, lending a sympathetic ear to somebody, smiling to each other, day after day, month after month. That's really going to help create and maintain that strong culture of companionate love that, and like what was found in that study, increase employee satisfaction and productivity, as well as the patient outcomes that come with it. So there are a couple of things that leaders can do to implement and start working towards that culture of companionate love. First, broaden your definition of what you understand is a culture. Instead of focusing on cognitive culture values such as teamwork, results, and result orientation, or innovation strategies that you can use within your facility, think about how you can cultivate and enrich emotional culture as well. So emotional culture can be based on love or other emotions such as joy and pride. Again, bringing us back to the joy in work. Second, pay attention to the emotions that you're expressing to employees every day. Your mood creates a cultural blueprint for the group. I remember when I was still in college and I was interning, I was working with one of the VPs at Rhode Island Hospital, and he indicated to me, like when he was having a really bad day or something was going like really wrong, that he would just have the poker face. And I said to him one day, I said, Doug, you're really good at like keeping everything together and not showing your emotions, um, you know, and having your emotions run rampant and, you know, it spreading to the rest of the employees. And he says to me, Josh, you need to be a duck on water. I was like, duck on water? What do you mean? He's like, when you're looking at a duck on the lake, it's just, you know, casually just floating around. But underneath the water, their legs are kicking like this and they're going crazy. So those days where you're feeling inside where everything's going crazy, you need to make sure that the emotions that you're expressing every day is, you know, positive, because that truly spreads to the rest of the facility. And lastly, consider how your company policies and practices can foster greater affection, care, and compassion and tenderness among your coworkers. Next slide, please.
Josh, when you're describing this to me, you know, nurses are interesting because, and I'm a nurse, so you know we are very driven by our work, and we get in there and we got to get it done, and we have a lot of things to do, and we're very compassionate to our residents and our patients. But what I'm hearing from you is treating our employees with the same compassion and love and support. And I think there's a lot of times I could evaluate my practice and my actions and having put that in perspective. I love this. This is great. Thank you.
Yeah, thanks, Melody. I mean, you bring up a really good point. I mean, how many times, I'm sure we could all think about times where we are treating residents with the utmost love and respect and compassion, but then we turn around and don't do the same to our fellow workers or employees. So it's really helpful to, you know, make that reflection and assessments and saying, hey, what if I started treating my fellow staff members with the same love, respect, and compassion that we do for our residents? It really makes a really big difference. Thanks so much, Melanie. So, you know, we talked about cultivating that culture of wellness. You know, what about resilience? We've heard resilience many times over the pandemic. What is resilience? So resilience is the process and outcome of successfully adapting to difficult or challenging life experience. And man, did we go through a challenging life experience, especially through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. So there's a number of factors that contribute to how well people adapt to adversities. Specifically, the way that individuals view and engage with the world, specifically the availability of resources, social resources available to them, and then their own specific coping strategies. So psychological research has actually demonstrated that the resources and skills associated with a more positive adaptation, also, you know, greater resilience, can actually be cultivated and practiced. Next slide, please. I'm going to pass it over to Margie to talk about these next couple of slides because you nurses have gone through, like I said earlier, you guys have gone through hell and back. So Margie, over to you if you have, if you want to chime in.
Thanks so much, Josh. I wanted to share with folks something that Cinda Rushton had talked about. And when we think about resilience and we think about this whole topic about wellness, and what happened is the pandemic had created this extraordinary experience where we used to kind of look at our patients and residents and try to care for them individually, bring that whole person-centeredness to the whole process of caring for them. But the pandemic made us have to go big. And instead, we had to take care of groups of people all at once. And we had to start triaging. And we had to start making decisions that as a community of healthcare workers, we were really being pushed to the limit a lot of times and had to make some really tough decisions. Case in point, I bet there isn't anybody here who didn't hate having to isolate residents. Sure, we didn't want people catching COVID, but initially we probably thought that it was just going to be for a few weeks and that was going to be okay. But then we realized, like, our folks with dementia were not going to do well in a situation where they were isolated for long lengths of time. And so what started to happen for a lot of folks was that we actually got into a place where we almost started to rewire our brains, because even though we were doing the best thing we knew how to do, we frequently were doing the thing that we really didn't love doing too much. Melanie, can you turn that slide? So sometimes, for instance, we were looking at things like we knew our staff was like burnt out, and yet we kind of would creep in and say, any chance you can pick up a couple of extra shifts? Even crazier, we had folks who had COVID. We had staff who had COVID, and sometimes we'd have to say, no, come in, we'll put you over on the COVID unit. And so those were the decisions that we were making, and they were hard. And the gap between what we can do and what we believed we should do began to create this thing called moral distress. And moral distress is something that we're kind of in the midst of at the moment, where we had to sometimes feel almost like we were compromising our integrity. We're compromising our staff. We're compromising like good health care to do something for the good of a bigger picture. Next slide, please. But what this work that I just sent you the link, that Cinda Rushton actually reminds us that we have an obligation. We actually, not just nurses, administrators, we always begin with patients as our first priority in our profession and in our ethical framework, but that doesn't mean we don't have an obligation to our own well-being and to our families. And so a lot of nurses and administrators and folks in our settings, we're beginning to grapple with questions like, am I causing harm to my family? You know, I'm here doing this good, important work, and yet my kids are at home on Zoom and not doing so well in school right now. And oh man, that's the moral distress that we're faced with. Next slide. And so what the American Nurses Association Code of Ethics has made really clear is that nurses have the same obligation to taking care of themselves as they do to other people. And so investment in somebody's well-being is not optional. It's a moral mandate. So the difference between moral distress and instead we're talking about a moral mandate that you actually have to step in and almost like rewire your brain. Next slide, please. So after such a length of time where we've been doing and living in this moral distress and making choices in that way, what we have to begin to do is look at and actually help to build our neural pathways for self-awareness and self-regulation, not skipping lunch, going out for a walk, doing a little. I'm appreciating Jean right on cue, went and brought her lunch in. I don't know if everybody saw that. But this helps our nervous system to actually begin to regain its balance so we don't have to get stuck in fight or flight or freeze mode for the duration. And so all of us, including all the nurses that we love and that Josh has so clearly pointed out, all of the nurses benefit from finding different outlets. And an example is that at one of the hospitals down Hopkins, they offer Mindful Ethical Practice Resilience Academy. And if you look that up, you'll see that they've done some remarkable work around this whole idea of moral resilience and doing away with moral distress. So next slide. So things to think about, and Josh and Melanie and Mary Ellen, feel free to jump in. Does that make sense to you? And what are some of the, here are some of the things, I don't know if you folks have had some experience with helping to build that resilience. Anything you want to chime in?
Margie, it's Mary Ellen. All of this discussion is just so needed. Looking back on my own experience through the pandemic, we tried in so many ways to create, wellness rooms or just a break for people to take a pause. And I think intuitively nurses just feel guilty about taking time away from the unit or the department and taking 5 minutes, to pause, to reset, or whatever we do on the computer that we should do for ourselves. But it certainly is helpful in the sense that you have to pause sometimes and just say, it seems like forever, but this is not forever. And we're going to get through this and be better for it. But, we just need reminders because we're so immersed in the moment of taking care of patients and residents. So this is a discussion that I wish had happened, 12 months ago, but we're learning about it now. And I think it's important outcome from all we faced during the pandemic.
Thank you. Thanks, Mary Ellen. Melanie, are you thinking something?
I was just thinking about, to piggyback on Mary Ellen, it's if you're walking through your units and you see staff sitting at the desk taking their break, send them away. Give them their 5 minutes, their 10 minutes to eat their lunch away from the desk, to decompress. And earlier in these topics, we talked about, you all have that staff member who will do that double for you. And they do back to back to back doubles, and to try not to ask that person because they need a break. And I think just being aware and acknowledging this has been a long time and people need some breaks. So just a good conversation. And Amber, thank you for your feedback. We really appreciate. She says, hello, everyone. I feel this to my core, and I'm so happy you're discussing it. We really like to hear from you that this program's working for you. So thank you, Amber.
So there's certainly the list of like cute things you can do to be resilient or to build your muscle. But I hope that previous slide gives you some real sense that you really need to start rewiring. And it's going to happen by developing small habits. It's going to be hard to break out of that kind of crisis, that moral distress, that whole thing that we've been kind of butting our heads against. But what we want to really start doing is to start rewiring to get back on balance. And that's really the message of the day, I think. Next slide.
Yeah, so there was a couple of reflections that we can have you guys walk away with. There's actually this little short story about an old tale where a man and his son are alternately and repeatedly confronted with bad luck and good fortune, and their neighbors constantly cluster around to either commiserate over the former or give congratulations to the later. But each time the man is retaining their poise and poses the same question. If it's a good thing or a bad thing, who knows? So, we've gone through many things in our lives, things that we thought was a bad things previously, but when we look back on was actually a good thing and ultimately, changed us who we are today. We look back at COVID and, how terrible it was. But what about some of the people who learned how important self-care was and, can actually say, for me personally, as my own personal growth and personal development, like I went through COVID and it was terrible, but it was actually a good thing because now I recognize the importance and follow self-care and practice that daily. So I'm not saying, COVID was ever a good thing, but there are experiences that we go through in our lives that we can reflect on to say we're better at the end of the day because of it. So there's last couple of things, there's a couple of process, 3 steps that you can go to cultivate new mode of thinking. You know, ask yourself these questions, be clear about what you're trying to classify as bad and why, and, you know, get your team involved in any discussions about any specific situations or scenarios that come up. Next slide. Like Margie said, it brings us back to Maslow's hierarchy of needs. If you're walking away today with one thing, like, to walk away with this checklist too. Start at the very bottom. You know, balance work, like Melanie said, you balancing working hours. You have one person that is covering a shift because someone left the organization, and you're keeping asking them, and you're going to keep asking them and keep asking them. Before you know it, they're going to get burnt out, and they're going to look for another job, and they're going to leave. So, you know, we got to find alternatives to that. You're making sure your team can actually go to the bathroom during their shift, or even have lunch. The, you know, basic needs, and just work your way up this pyramid. It's going to make all the difference. There's some resources that I will put in chat for you guys, and that should be it.